The average human spends roughly 26 years of their life completely asleep. Yet most people give zero thought to the exact physical posture their body assumes once they close their eyes. Every sleep position comes with a specific set of trade-offs. What relieves lower back pressure might worsen sleep apnea. What stops acid reflux might compress peripheral nerves in your arms. In this video, we are breaking down every major sleeping position and ranking them, explaining the clinical risks and anatomical effects of each posture. Fetal position is the most common sleeping posture in the world, adopted by over 40% of adults. In this side-lying posture, the spine is flexed forward, the knees are drawn up toward the chest, and the chin is tucked downward toward the torso. From a biomechanical standpoint, curling into a side flex posture opens up the posterior spaces between your vertebrae. For individuals suffering from lumbar spinal stenosis or degenerative disc disease, this posture takes direct pressure off pinched spinal nerves, offering significant pain relief. For pregnant women, the fetal position, specifically when lying on the left side, is the clinical gold standard. It keeps the heavy weight of the growing uterus from compressing the inferior vena cava, which is the large vein that returns blood from the lower extremities back to the heart. Lying on your side prevents the base of the tongue and soft palate from collapsing backward into the throat, significantly reducing snoring and mild obstructive sleep apnea compared to lying flat on your back. However, there are clinical downsides. Curling too tightly into a hard ball restricts the full movement of your diaphragm, limiting deep abdominal breathing during sleep. It also places the spine in a prolonged C-shaped flexion, which can lead to morning joint stiffness, neck strain, and hamstring tightness if maintained all night without movement. In the soldier position, you lie completely flat on your back in a supine position, with your legs straight and extended, and both arms extended straight down, flush against the sides of your body. The primary biomechanical advantage of the soldier position is neutral spinal distribution. It evenly distributes your body weight across the entire surface area of your mattress. There are no unnatural twists in the neck or lower back, allowing the cervical, thoracic, and lumbar spine to rest in a natural alignment, provided your mattress offers proper lumbar support. Dermatologically, because your face is completely exposed to the air rather than pressed into a pillow, the soldier position eliminates facial skin friction, reducing sleep lines and acne caused by trapped oils. It also avoids compressing your shoulder and hip joints. The major clinical danger of the soldier position, however, is airway collapse. Gravity pulls the tongue, soft palate, and surrounding throat tissues downward into the airway. For people who snore or suffer from obstructive sleep apnea, the soldier position is often the absolute worst posture, causing severe drops in blood oxygen levels throughout the night. Additionally, lying flat on your back without a pillow under your knees can cause your lower back to arch excessively, worsening lower back pain caused by lordosis. Left side, right side sleeping. While side sleeping generally benefits spinal alignment, the internal asymmetry of human anatomy means that sleeping on your left side produces drastically different biological effects than sleeping on your right side. If you suffer from acid reflux or GERD, left side sleeping is a major physical intervention. The stomach is shaped like a curved pouch located on the left side of your upper abdomen. When you sleep on your left side, gastric juices pool at the bottom of the stomach, sitting well below the lower esophageal sphincter. This mechanically prevents stomach acid from flowing upward into the esophagus. If you flip to your right side, the stomach sits above the esophageal sphincter, allowing acid to leak upward and trigger severe heartburn. Left side sleeping also optimizes lymphatic and glymphatic clearance. The body's lymphatic system drains primarily through the thoracic duct on the left side. Furthermore, brain imaging studies show that side sleeping, particularly on the left, optimizes the glymphatic system, the brain's waste removal network that clears metabolic toxins like beta-amyloid proteins while you sleep. On the flip side, right side sleeping has its own specific medical advantages. When you sleep on your left side, your heart shifts under the pull of gravity and presses against the chest wall. Sleeping on your right side keeps the heart centrally positioned inside the chest, supported by the lungs. This lowers cardiac sympathetic nerve activity, reducing mechanical stress on the heart. For patients with congestive heart failure or certain heart arrhythmias, right side sleeping is often recommended by cardiologists. In the Yearner is a lateral side sleeping posture where both legs are extended straight or slightly bent, but both arms are stretched straight out in front of the chest at a 90-degree angle, as if reaching forward. Like other side sleeping positions, the Yearner keeps the upper airway wide open, reducing snoring and preventing obstructive sleep apnea events. It also maintains a relatively elongated spine compared to the tight curl of the fetal position. The slight forward angle of the arms can help stabilize the upper torso, preventing you from rolling all the way onto your stomach. However, extending your arms straight out in front of you for hours places continuous tension on the nerves of the neck and shoulder girdle. Specifically, this posture can compress the radial and median nerves, as well as the brachial plexus nerve network. This restricts blood flow into the arms, causing sleepers to wake up with painful pins and needles, hand numbness, or temporary localized weakness. It can also worsen carpal tunnel syndrome and rotator cuff impingement. Stomach sleeping. In the stomach position, often referred to as the freefall position, you lie completely prone on your abdomen. The arms are typically elevated and wrapped around or under the pillow, and the head is turned 90 degrees to either the left or the right side to allow breathing. The main advantage of stomach sleeping is complete airway openness. Stomach sleeping is exceptionally effective at eliminating snoring and obstructive sleep apnea. Because gravity pulls the tongue and throat tissues forward toward the mattress, the airway remains completely open throughout the night. Despite its respiratory benefits, stomach sleeping is considered by physical therapists and orthopedic surgeons to be the most damaging posture for overall spinal health. To breathe while lying flat on your stomach, you must hold your head rotated at an extreme 90-degree angle for hours at a time. This places severe torsional stress on the cervical vertebrae, strains the neck muscles, and twists the vertebral arteries that supply blood to the brain. Simultaneously, lying on your stomach causes your abdomen to sink into the mattress, flattening the natural curve of your spine and forcing the lumbar region into hyperextension. This continuous compression of the lower spinal joints is a leading cause of morning lower back stiffness. The log position is a rigid side sleeping posture where you lie on your side with both legs extended completely straight down and both arms resting flush against the sides of your torso, creating a straight line from head to toe. The primary benefit of the log position is neutral lateral elongation. The log position keeps the spinal column elongated in a near-perfect neutral alignment. Unlike the fetal position, there is no forward bending of the neck or spine, which reduces muscle tension along the back. It also delivers all the respiratory advantages of side sleeping, keeping the airway clear and preventing obstructive sleep apnea without constricting the chest or lungs. For individuals recovering from spinal injuries or acute back pain, the log position maintains a stable posture that prevents twisting of the vertebrae. However, without proper pillow support, the log position creates a mechanical imbalance at the hips. The top leg tends to drop forward and rest on the mattress, pulling the upper hip forward and putting a twisting torque on the lower spine. Additionally, resting your lower shoulder directly underneath your full body weight can cause shoulder joint compression and restrict blood flow to the lower arm. The starfish position. In the starfish position, you lie flat on your back in a supine posture. But unlike the soldier position, your legs are spread wide apart and both arms are bent upward at the elbows, resting above your head or framing the pillow. Like all back sleeping postures, the starfish position evenly distributes body mass across the mattress, avoiding pressure points on the hips, ribs, and shoulders. It keeps the face completely clear of pillow contact, preventing skin irritation and facial compression lines. Placing the arms above the head can also help stretch the upper back muscles and open up the chest cage, reducing pressure on the middle spine. However, holding your arms elevated above your head for extended periods puts direct pressure on the nerves of the shoulder girdle and brachial plexus. This frequently leads to arm numbness, shoulder impingement, and stiffness in the neck and trapezius muscles. Furthermore, just like the soldier position, lying flat on your back allows gravity to pull the tongue and soft palate backward, carrying a very high risk of triggering loud snoring and severe obstructive sleep apnea events. Pillow hugging is an engineered modification to side sleeping. In this posture, you lie on your side while actively hugging a pillow against your chest with both arms, while simultaneously placing a second pillow between your knees and ankles. Placing a firm pillow between your knees while side sleeping is one of the most effective mechanical interventions for back pain. It prevents your top leg from sliding forward, keeping your knees, hips, and pelvis stacked in parallel alignment. This eliminates twisting torque on the lower spine and sacroiliac joints. Hugging a pillow against your chest prevents your top arm from dropping forward and collapsing your upper shoulder joint. This keeps your chest open, reduces tension on your chest muscles, and prevents rotator cuff compression. By keeping the chest elevated and supported, pillow hugging also prevents the rib cage from compressing, allowing full breathing depth while keeping the airway wide open. There are virtually no negative clinical side effects to proper pillow hugging, provided the pillows used are of the correct thickness to maintain neutral alignment rather than forcing your joints out of position. Elevated sleeping is a targeted posture achieved using an adjustable bed frame or a specialized wedge pillow. The sleeper lies on their back, but their head, neck, and upper torso are elevated at a continuous angle of 15 to 30 degrees above the rest of the body. This posture provides clinical acid reflux elimination. Elevating the upper torso relies on simple gravity to keep stomach acid contained inside the stomach pouch. Clinical studies show that sleeping at a 20-degree incline reduces nocturnal acid exposure in the esophagus by over 60%, making it one of the most effective non-drug treatments for severe acid reflux. Unlike flat back sleeping, elevating the head and torso prevents gravity from pulling the soft tissues of the throat down into the airway. It keeps the airway wide open, significantly reducing obstructive sleep apnea episodes and snoring. Elevation also uses gravity to prevent fluid retention in the head and neck. This dramatically reduces nasal congestion, sinus pressure, postnasal drip, and morning facial swelling. The only major risk occurs if your setup elevates only your head rather than your entire upper torso from the waist, which can bend the neck forward and cause severe neck strain. Combination sleepers do not stay in a single posture throughout the night. Instead, They shift fluidly between back, side, and stomach positions, averaging anywhere from 10 to over 30 distinct posture changes per night. The primary advantage of combination sleeping is constant dynamic pressure relief. By shifting positions throughout the night, the body prevents prolonged pressure on any single joint, nerve, or skin area, preventing localized numbness and joint stiffness. Continuous movement during sleep also helps circulate fluid through your joint capsules and aids in the natural rehydration of spinal discs that were compressed during the day. The subconscious brain uses movement to resolve discomfort. If an arm loses blood flow or an airway becomes restricted, the brain initiates a shift to resolve the stress automatically. However, if positional changes are extremely frequent, occurring every few minutes, it may indicate underlying sleep fragmentation, restless leg syndrome, an uncomfortable mattress, or frequent awakenings caused by undiagnosed sleep apnea. If you found this breakdown helpful, hit the like button, subscribe to the channel, and check out the next video on screen right now. Thanks for watching.